Why are muscle biopsies crucial for challenging muscular dystrophy diagnoses? Imagine trying to solve a complex puzzle where some pieces are missing or unclear. That's often what diagnosing muscular dystrophy can feel like. While genetic tests and blood work are helpful, they don't always tell the full story. That's where muscle biopsies come into play. They provide a direct look inside the muscle tissue itself, giving doctors vital clues that other tests might miss. When symptoms are unusual or genetic results are inconclusive, a muscle biopsy can reveal the true nature of the muscle problem. A muscle biopsy involves removing a small piece of muscle tissue, usually about the size of a matchstick, from a muscle that shows signs of weakness. This tissue is then examined under a microscope. The detailed view shows changes in muscle fibers, such as degeneration, regeneration, or scarring. These microscopic features help confirm whether a muscle disease is present and can link symptoms to specific tissue abnormalities. This is especially important when symptoms or initial tests don't clearly point to a specific diagnosis. Another key reason for a muscle biopsy is to tell different types of muscular dystrophy apart. For example, in Duchenne and Becker muscular dystrophy, the amount and function of a protein called dystrophin are affected. Using special staining techniques, doctors can measure dystrophin levels directly in the muscle tissue. This helps determine how severe the disease might be and whether it's Duchenne or Becker, which can look similar at first but have different progressions. Muscle biopsies are also essential for distinguishing muscular dystrophies from other muscle conditions. Some inflammatory muscle diseases, like myositis, show signs of inflammation and immune cell infiltration, which are different from the changes seen in muscular dystrophy. Identifying these differences helps doctors choose the right treatment and avoid unnecessary or ineffective therapies. While genetic testing is often the first step in diagnosing muscular dystrophy, it doesn't always find the mutation or may miss new or rare variants. In such cases, a muscle biopsy can provide crucial information. The tissue analysis can guide further genetic testing or confirm a diagnosis when genetic results are unclear or negative despite strong clinical suspicion. Choosing the right muscle to biopsy is also important. Doctors typically select a muscle that is affected but not too severely damaged. A muscle with moderate weakness often shows characteristic disease features without being so damaged that the tissue is uninformative. This careful selection increases the chances of getting useful diagnostic information. Early muscle biopsy can speed up diagnosis, especially in complex cases. It helps identify the specific type of muscular dystrophy, which can influence treatment options and help with planning for the future. Knowing the exact subtype can also guide screening for related health issues, such as heart or lung problems, and inform family planning decisions. In summary, muscle biopsies are a powerful tool in the diagnosis of muscular dystrophy, especially when other tests don't provide clear answers. They give a direct look at muscle tissue, confirming disease presence, helping distinguish between different types, and ruling out other muscle conditions. This detailed insight supports accurate diagnosis and personalized care, ensuring patients receive the most appropriate management for their specific condition. Always remember to consult healthcare professionals for personalized advice and diagnosis.